Hello everyone, welcome back to Stud Eye. Today we are going to discuss some tests which are related to visual assessment. So here we are going to discuss that how can we assess visual acuity in different age groups, right? So we have different age group which include infant. Infants means that from newborn up to 1 year kid, and then we have a category which is 2 years kid. Then we have 3 years to school going, which can be 3 to 4 years, and 5 years. After 5 years, we know that a person is growing. So in that case, what will happen that the test which we are using for a 5-year-old kid is same for the person which is more than 5 years of age, right? So now, first of all, for infants, how you can check their vision or how can you assess their visual acuity? We have different tests for infants. So over here, as you all know that the newborns and up to age of 1 year, a child doesn't speak. So in that case, you cannot assess the visions by subjective method. Therefore, we have different types of tests that include, first of all, fixation and following by face, in which you have to grab the attention of the infant by showing your face. So when the patient sees your face, is he able to fixate, and then you have to move your face a little bit right and left in order to check that either the patient follows my face or not. So you have to see that is there any fixation and following. Then after checking the fixation and following by face, you have to move towards the second step, which is fixation and following by any puppet. So in this case, what you are going to do, you have to do the same as you were doing with the first test, which was fixation and following by the face, but the target is now the any puppet instead of your face, and you have to move that puppet and see that either the patient is focusing on to that puppet or not, and you have to move it and you have to see that is he following, because the child has the ability to fixate something which is attractive and more colorful. So we have a third test, that is comparison, and other name of comparison test is unilateral preference. In this test, what you have to do is that you have to place your hand on either of a eye of the infant. So you have to close any of the eye and you have to check that does he reacts to it. He will not complain, but he can react to it by crying or simply getting irritated by placing the by trying to remove your hand from his eye if he has the vision in that eye. So basically we are assessing his vision. We are checking that either the patient is able to see or not, and if there is no vision in patient's eye, what will happen that he will not fixate when you are showing your face. He will not fixate when you will show any puppet. He will not react if there is no vision in his eye when you will close that eye, right? So if there is any vision, patient will react, he will get irritated and he will try to remove your hand. But if there is no vision in that eye which you have closed, patient will not react. The infant will not cry, not get irritated, because he cannot see with that eye. So he will not get any kind of problem when you will place your hand in front of his eye which is not having any vision, right? Okay, so now next we have the third test, that is rotatory test, which is the primary test for the evaluation of the nystagmus, and it is very important test. So in this test you evaluate that either the patient has nystagmus in his eyes or not. So what you have to do is in this test is that you have to pick the child up and you have to rotate the child. So you have to rotate it 180-degree clockwise and 180-degree anti-clockwise, and then what you have to do is that you have to see that is either the eyes of the patient are still or not. If the eyes of the infant is still is moving, like what will happen that first of all when you will rotate the kid, the eyes will move, they will be in a moment now. So what will happen if their eyes are still after 2 to 3 seconds, it means that patient's eye is normal. But if the movement of the eye is continuous or it is more than 2 to 3 seconds, it means that there is nystagmus in the patient's eye. So this is how you can evaluate that either the patient has nystagmus in his eye or not. Okay, so next test we have is preferential grating test. In this test we show a child two surfaces. So one board is fully plain, white fully plain surface, while other one is having black and white lines on it. So what we see is that either patient fixate on the one which is having lines on it, right? So we have to, if, as I have already told you, that a patient or a child or infant used to fixate on a thing which is very attractive or which is having some color difference. So if a patient which is having a vision, or if an infant is having a vision in his eye, then what will happen, that he will try to fixate on the one which is having the bars or which is having the white and black lines on it, right? So we have to see that can patient see it. If he is viewing, he does not fixate onto the black and white lines and he is viewing onto a plain surface, it means that there is no vision in the patient's eye, or there is some problem in the child's eye. Now we have another test, that is visual evoked response. This is the electronic method or a computerized method in which you have to place the electrodes on the occipital lobe of the infant and you check the visual pathway. You have to see that either the optic nerve and visual pathway is accurately working or is okay. So for that you can do this test, right? And so there are other tests which you can perform in infants, that will include the retinoscopy while you have given the patient sedative in case of the infants, because they cry a lot. So you can give them sedatives and you can do retinoscopy for the assessment of the vision. And there are a lot of other tests, but these are the basic tests you can do in infants in order to assess their visual acuity. So next group is 2 years, which can also be categorized as toddlers. Over here, as a toddler, they enjoy the colorful things, right? So they try to pick things, they will crawl. So at that stage you can perform cardiac acuity test, candy test and balls test, because the balls and candies so are the colorful things and they can get attracted, and if they have the vision they will try to grab it. So you can estimate or evaluate, yes, that patient is having a vision in his eye. And one more thing, that retino is something you can perform in any age group, right? So in kids you can it's more appropriate to do the cycloplegic refraction after giving sedatives to the patient. So next age group is 3 years to school going. They are the active ones and they are able to identify the pictures. So in that case, the test you can do for these type of kid is that you can perform the K picture test, Leah symbol test and the Teller acuity chart. So K picture and Leah symbol test have some pictures on it, like a tree, sparrow, car or any other pictures on it, so which you have to ask the kid that can you identify it, and if he can identify it, it means that patient is having a vision and he is able to see. So it's similar to the one you are performing with the Snellen chart, but the difference will be in the case of the K picture is that instead of the alphabets you have the pictures, right? So the last age group is 5 years of age. Now the child has the ability to read the letters, right? So he can read and he is a grown up child, so he can respond to what you have asked, right? So in that case you can perform simply the Snellen acuity chart and you can perform the Logmar acuity chart. So Snellen and Logmar charts are the commonly used test charts that can be used for the assessment of the visual acuity in the older patients, in the younger patients and in adults as well, right? So if a child is from of the age 5, it means that you can perform the Snellen chart or Logmar chart for the assessment of the visual acuity. So from 5 to upward, any age limit, you can perform either of these test charts, right? So it's all about today's lecture, in which we have discussed that how you can assess visual acuity in different age groups, and I hope it is very clear to you. In case of any query, comment in comment section, and thank you so much.